Hi, I'm Dr. Anna Marie, and this is my canine kid, Emlyn. I adopted her from Guiding Eyes from the Blind on December 28th, 2013. She was an amazing Christmas present. Now that we're entering a new year and Emlyn is entering her 10th year of life, I'm happy to report that she's completely healthy. For 3 years, get up here, come on. For 3 years, Emlyn's key liver enzyme was increasing, and in 2023, it was spiking off the charts. She basically won a battle against copper storage disease, and that's a topic every pet parent should be aware of. On today's show, we're sitting down with Dr. Pete VanVranken, the veterinarian that helped guide us through Emlyn's treatment protocol, and I have to credit him for saving my dog's life.
My name is Pete VanVranken. Actually, my real name's Philip, but I go by Pete. I'm a practicing veterinarian, been out of school 49 years. This is my 49th year in practice, where my passion is trying to eradicate copper storage disease. And you're familiar with that because your dog Emlyn has that. So.
Well, I must admit, Doc, you gave me probably the best Christmas present I ever could receive. This time last year, I was dealing with a dog that was 300, 400, up to almost 1,000 liver enzymes off the chart. And fortunately to you, I now have a dog that's normal. Her last blood work last week was 125.
Well, you're a lucky girl, and that's I think it was 120, and I think 15 to 25 is normal. So you're back in the normal area, which is really good. I'm happy for you, and I'm even happier for Emlyn because she can have a enjoyable and fruitful life.
Explain why this trace mineral is so, in simple terms, if you could explain to folks why copper is so important to dogs.
Well, it's important because it's involved in a lot of the enzyme systems that dogs have. And so we want to make sure that dogs have enough copper in their diet to sustain themselves, to have normal body functions. And really there's a number of things. It's an integral part of making red cells. We talk about that a little bit from time to time, but right now, as we know it, most dog foods have probably more copper in it than they should. And so it's been one of the functions of AFCO to make sure that there was enough copper in dog food. And quite frankly, there was enough copper in dog food all by itself, just being fed the native ingredients without adding more copper.
Have you ever seen copper deficiency? Is this common in dogs, copper deficiency?
Copper deficiency is not common at all. We don't see, you can actually Google copper deficiency and nobody can actually describe it. And people have, and that's one of the things that the dog food industries have kind of discussed. They think they don't want dogs to have copper deficiency. It's really one of those things where the copper deficiency thing is not really formally diagnosed. People talk about it, but nobody can put their finger on it. So it's really one of these things we're trying to prevent that really doesn't need to be prevented.
So copper storage disease, which my dog Emlyn, we believe, battled, because when we will get into how we kind of work together and getting her healthy again, but too much copper toxicity, copper storage disease. Can you kind of explain the sense of when copper accumulates in the liver, what happens to these dogs?
Okay, well, let's start from the very beginning. I just got done having lunch. I went out and had potato salad. It had some copper in it. I have what they call garbage up potato soup, which means I put onions and bacon and cheese and all sorts of stuff. All that stuff has some copper in it. Do I need to supplement my copper so I can live? No, not really. I'm getting enough copper in my diet just as the way I eat to never have copper deficiency. And the same with dogs. They really don't need to have much supplemented also. However, and this is where the difficult part of the story comes, is that a number of years ago, somebody did some studies on pigs and decided that pigs grew faster when they got copper sulfate put in their pig food. So copper sulfate is copper sulfate is a drug, really. It's cupric oxide treated with sulfuric acid. So, just the idea that we're going to put sulfuric acid or some form thereof in dog foods is kind of concerning. It is a good thing to the extent that it is very bioavailable. And that's why the dog food industry is dictating that those are the coppers that all the companies use to put in their dog food. Very bioavailable. So that means when you eat something with copper sulfate in it, you utilize almost all the copper sulfate that was in that product. Because we have certain dogs that are not able to get this it gets put in their liver and it never gets taken out in such a manner that it doesn't really start to accumulate. Imagine that you have a 15-gallon gas tank on your car, and every day you go fill it up with 25 gallons of gas. It's obviously more gas than your car can accommodate.
Are there early signs that a dog has too much copper?
There are really no early signs. Sometimes their appetite kind of decreases. My dog had copper storage disease, and she'd lost about 5 pounds by the time we kind of figured out that she had something going on. So weight loss, icterus or jaundice, where you kind of turn yellow. Your skin pallor has yellow in it. Vomiting, decreased appetite. The signs and symptoms are extremely vague. So there isn't this one classic sign that you're going to see. For instance, people get this same thing called Wilson's disease, and when they get Wilson's disease, there's a little brown ring that occurs in their iris of their eye.
Emlyn is now 10. When she was 7, the vet recommended doing a senior wellness blood test on her. And we saw back when she was, 7 years of age, that there was an ALT level increase. It was like in the 200s. And we put her on some supplements, brought the numbers down, didn't really discuss it. And then last November of 2022, she started sort of staring at the wall, fatigue, not my dog. And that's why we did the retest. And that's why I was shocked to see the numbers pretty much doubled. So do you recommend people, maybe for certain breeds, certain age, to get a blood test?
Yeah, so I deal with a lot of people who have dogs who have copper storage disease, and most of them tell me that they picked it up by accident. In other words, they went, the one story I just heard today, as a matter of fact, is that somebody went ahead and they were scheduling their dog for an ACL repair, a knee repair, and they did a pre-surgical screening, and they saw the ALT was really, really high. So they put off doing the surgery, figured out what was wrong with their dog, and got it fixed. But they were this is kind of the stumbling on to it part. Every once in a while, somebody's taking a pair of socks out of a dog that ate the socks, and they're taking it out of the stomach, which is right next to the liver. And sometimes the veterinarian will look at that liver and go, well, that doesn't really look quite right. They'll do a biopsy, and they figure it out that, they get the socks out, and the dog lives because he got the socks out. But the really saving grace, the best thing that dog ever did was eat the socks, because now the doctor saw that the dog had a discolored liver, and there were some little bumps on it stuff. So they did the biopsy and figured out it was copper storage disease. So what they got was a much better hamper, so their dog could not get into the hamper and eat the socks. And then they fixed the copper storage disease. So those dogs are very lucky.
In your literature, folks might see behind you, your Voyager Dog Food, which you're the proud creator of. And I'm proud to say that's what I feed my dogs. And they love it, by the way. This isn't something new. This has been going on for a while. There was research that was done in 1929, and it's in your literature. You actually do a nice breakdown over the years. Could you explain to folks in the sense of the numbers and how they've been increasing?
Well, in some lab in a state university someplace, people have livers that they've taken from dogs back in 1929. Right during the Depression, I guess. And those dogs' livers were put in formalin, and they sat there and nothing happened to them. And since then, as this disease progressed, we were kind of curious as to what they were like years and years ago. And the levels in the livers were non-detectable, almost, when you go back then, because we weren't adding copper sulfate and we weren't adding proteinaceous copper into dog foods. And then as we've done, and really what we've done, we've allowed it to get into all the native ingredients. In other words, if you go out and buy liverwurst, for instance, there'll be a fair amount of copper in liverwurst, no matter what species the liverwurst is made out of. If you buy this diet or that diet, a lot of them have meat products that were fed copper sulfate. So we've gradually kind of introduced all this copper into diets, and most dogs will tolerate it fairly well. But there is probably, and I'm going to take a wild stab at this, I'm going to guess that there's probably more than 35% of the dogs that by the time they've reached the elderly ages have started to accumulate copper in their liver. And some of them not too bad, but then like Emlyn, very bad. And you can get it out, but you just have to be fairly aggressive about doing that.
Doc, what's going on? Why isn't the AFCO, which stands for the American Feed Control Officials, they're there to protect our dogs. Why aren't they doing something? Why isn't something being done? This is obviously growing in our country, and it seems as though they're kind of like poo-pooing it, like there's not a problem.
Evidence-based, you heard the term evidence-based medicine, and this is evidence-based. So we know that since they started adding this, they started adding it in dog food in 1997, I believe. And there was very few cases of copper storage disease up to 1997. Then it took them about 4 or 5 years to disrupt everything with this copper sulfate, proteinaceous copper. So by the early 2000s, probably 2004, 2005, we started to pick up on these cases. And I said evidence-based, and believe it or not, I'm a graduate of Michigan State University, proud graduate of Michigan State University, and they're kind of at the forefront. They and Colorado State and Cornell are working on these things, and they actually did a little project to see what the incidence was prior to putting this in. And in Labrador Retrievers, which is the good doctor here owns a Labrador Retriever. I think it was 1 out of 53 dogs had a copper count of more than 1,000 parts per million. So then they did it from 2005 to 2014 or something along that nature. And they took 100 Labradors in this case, and I think there were 31 or 2, something, I can't remember the number exactly, 31 or 2 of them had copper over 1,000 parts per million. So you've gone from essentially about 2% all the way up to 31%. So that's a 1,660% increase in copper storage disease in those Labradors. So this isn't even close. I mean, this isn't like you need a PhD in statistics to figure this out. That this is just sort of recklessness on their part, putting something like this in there without actually identifying the products and how they would affect a dog long term. So now some of the universities have started to point this out to the general veterinary community, and in fact, for that matter, the AFCO people had this pointed out to them, and they think it's just they refer to it as weak science. So you've increased the disease by 1,660% in Labrador Retrievers, and we're calling it weak science.
Now I understand this topic. I saw a quote in an article, and I like this quote because I felt this way. I still kind of feel this way. Matter of fact, I feel this way when I look at my dog and see what I went through for the past year. But in the sense of you being mad as hell, quote unquote, mad as hell, because you went through this.
Right. Well, it was a series of 3 things. Really sad. I was sad first, and then I was mad second. And then usually I get over being mad. But this time I didn't get over being mad. I got mad as hell because I got stonewalled by the people that manufactured the dog food that our family dog Cookie ate. And I thought this was going to be pretty simple. Hey, here's the science. So what are we going to do about this? Let's fix this as veterinarians and the dog food industry. Let's go ahead and fix this. This is fixable. And they kind of decided it wasn't fixable. So we're kind of left with this. As you can see, I'm not 25 years old. I before I started my dog food company, I looked in the mirror every morning when I shaved, and I thought, "Are you really going to do this? Are you really going to do this?" And I said, "Yeah, I'm really going to do this." And it's weird because I woke up every morning at 4:30 or 5 o'clock thinking about it, and then I decided to do this, and I slept until 6:30. And so I got a lot more sleep when I decided to do it.
Well, thank you personally for creating a quality, clean, safe dog food. For folks that, and we'll talk more about Voyager here shortly, but a lot of folks might be saying, wait a second, how do I know what the copper level? Now, this is a catch-22, because you might see the ingredients, which most likely you're going to see copper sulfate or copper proteinate in the ingredients in the back of your dog food bag, but there's no numbers. So you have to call these companies and ask them. I actually personally called 100 dog food companies, and I'll be more than glad to share in this article to folks so they could actually quickly look up to see what dog food that they're feeding their dog, and they'll see the copper levels. And I was very disheartened to see how few of dog food companies come in that healthy range. Here in the United States, AFCO, or again, American Feed Control officials, say a minimum of 7.3 milligrams per kilogram, but there's no maximum. I called one dog food company, they were 66 milligrams per kilogram.
Yep, it's dangerous. I mean, that's at the level there ought to be skull and crossbones, right behind the copper sulfate or copper proteinate. And sometimes it's a combination of things, that there's sometimes it's a fish diet where the fish are grown in a pond and they're putting copper sulfate in the pond to control the algae, and then they're putting copper sulfate in the fish food, and then they're putting pork meal in the fish food, and guess what, the pork were fed before they went into the fish meal. And so you have all these things that kind of contribute to it, and I don't think it's anything they're nefariously doing. I just think it's I don't know how to describe it, probably ignorance, or they all have to kind of know, at least the big boys, they know what's going on here, and they've just decided that it's what do they used to refer to it in war, casualties, that there'll be a few casualties that were unintentional, but they're still casualties. And so this is kind of happening, and you were really mad. I mean, you were spitting fire the first couple of times I talked to you, and I wasn't spitting fire. I'd already been through this, so I mean, you
kept me calm.
I was unemotional. Yeah, I still get excited. I mean, I was like, okay, let's just relax here. We'll figure out how we're going to do this, and we did it. And
we're going to get to that. We're going to get to that shortly, Dr. Pete. But the one thing I want you to explain to folks, though, so what is the number that they look at my list, or they call the company? What are the magic numbers? There's a minimum, but there's a maximum that people should be looking for. What are the key numbers when it comes to copper in the diet?
I was going to pick a maximum. I'd pick it at 15. Now that's where they're having a problem, because it's a very narrow range. So they're going to have to engineer their diets to meet the safety levels, okay? And they don't want to do that. Now, just for the record, the people in Europe know about it, because they have a maximum of 25 parts per million, or milligrams per kilogram. So they have it is 7.3 to 25. Well, that's quite a range. That shouldn't be too hard to do, but I think they're just circling the wagons, and I have no idea why.
Voyager Dog Food, how do you meet the numbers? Where are you at copper-wise? And how do you meet that? Are you adding any man-made copper to your food?
Absolutely none. We just reverse engineer everything. So we send everything in, find how much is in it, and then make the diet to match the number I want to have, and then without short-shooting the dog. And so, it's not like our diets are restricted in protein or anything like that. We make what we consider, I used to refer to it as we mark the cards. So I'm always a winner. So I mark the cards, so I'm always a winner. And when we made our dog foods, and we talked about it, and said, let's just make something we'd be proud to feed our own dog. That's what we should do. Let's just do that. That's simple. And because we love our dogs, it's I've never met your dog, but I'm sure I would like Emlyn, but I love my own dogs. My own dogs sleep on my bed, and so I love my dog, so I'm emotionally attached. But and that was where you and I got along well, because I wasn't emotionally attached. I was making all the right decisions, or most of the right decisions, or helping you make the right decisions and stuff. And so I'm just making something that actually, I'm still a practicing veterinarian, so my clients are feeding my food, my friends are feeding my food, my family's feeding my food, so I'm taking care of the people I live and work with.
And your dog, if you would like to just reemphasize Voyager Dog Food, which is available on your website, and you can learn more about it at safedogfood.com. Also, that's your other website, safedogfood.com. Voyager Dog Food, besides being healthy for copper, it has some other good benefits. Can you explain to folks in the sense of, for dogs with allergies, in the sense of lowering the risk of cardio issues? Can you kind of tell folks in a nutshell?
Well, I just got done telling you, I like to mark cards, and to win, you have to mark all the cards, not just a couple of the cards. So we marked all the cards. So I made sure that we were restricting the amount of copper, sulfate, and proteinaceous copper that your dog is going to be exposed to. We also knew that based on evidence, evidence-based nutrition, is that a lot of dogs who are on grain-free diets are starting to develop heart disease. And we know this has been going on now for 5 or 6 years. That work has done it tough. So anybody who wants to read about DCM or dilated cardiomyopathy will learn to understand that some of these dogs that are on grain-free diets, in other words, dogs that are fed potatoes, lentils, peas, and that sort of thing, and unique proteins, can or may have some cardiac problems. Dilated cardiomyopathy is where you take a normal heart and it gets expanded to where it's bigger and bigger and bigger. And as that happens, the muscle gets stretched out and it no longer functions particularly well. Do dogs die from that? Certainly they do. Have we dealt with DCM my whole life as a veterinarian? Yes, I have. Most of them back in the day were hereditary. But nowadays, a lot of them are nutritionally induced, and they're really, really different, because when you put them back on a grain-inclusive diet, then that heart sometimes will go back to where it's normal shape. And that has never happened. Before, when they got DCM or dilated cardiomyopathy, we told people, you should buy a small bag of dog food because, these guys don't last very long. So we did that. So we made them grain inclusive, no copper. And then the third part is I told you what I like to do at work. Well, we do a lot of clinical trials at work. So we do clinical trials for ear infections, skin infections, all that sort of thing. What we learned, and we knew this kind of going into these trials, that a lot of these dogs that had chronic ear infections and chronic hot spots, those sorts of things, were actually food allergy dogs. So then the question is, what are they allergic to? Well, we kind of knew this going in, but we really knew it when we got done that my favorite German car, BMW, no beef, no milk, no wheat. Those are the three things that most dogs are allergic to. Can you be allergic to other things? Certainly. Are you going to be allergic to lima beans? Probably not. How about green beans? Probably not. Chicken? Maybe. Ostrich? Unusually not something you normally find in a food, but you could be allergic to anything. So, but we knew that 90% of it was going to be beef, milk, or wheat. So we just took beef, milk, and wheat out of the diet. Made it grain inclusive, took all the copper out.
So you're liver healthy, heart healthy, and skin healthy. Overall, a good, clean dog food. Doc, a lot of folks, I want to wrap things up talking about Emlyn's unique situation. I decided not to go, and maybe you could explain in a nutshell better than myself, but what you've faced in the past and why you're such an advocate of helping people around the whole country deal with copper storage disease. What is a traditional thing? You got the high increased ALT levels, then they want a biopsy, then they want to chelate, then you're going to go through. I know there's a whole order here. I didn't take that route.
Well, you understood when you got started here that Emlyn had high liver enzymes off and on for a while. So we kind of understood, and you understood that this wasn't an acute condition like maybe we chewed on some solvent or something like that and it really injured the liver. You knew that this was chronic. So that made decision making a lot easier. So you put them on SAMe and milk thistle and ursodeol and all the quote unquote the liver drugs. And then we repeat the test and they were still high. So now we know that the protectants like SAMe and milk thistle and ursodeol were not going to help Emlyn. So then we had to make a decision. Now what are we going to do? We could suppose maybe there was an infectious disease in the liver and you could be on antibiotics and you could be on steroids. So you try these various clinical trials. You can't try these for years, and I'm not even sure you can try them for months. I think you go 2 or 3 months, and then if you haven't figured out what it is, then you have to have serious therapy. So then we talked about, you want to do a liver biopsy. We actually do ours surgically. A lot of people get them done with a laparoscope, but we do ours surgically, just make an incision right about there and get a little piece of liver, a couple of pieces, and send it to the pathologist. That obviously is the most accurate way to do this, without a doubt. We can tell you whether it's inflammatory in response, if you got cirrhosis of the liver, how much copper's in the liver, and you have to have a nice piece of that liver. You can't, they talk about some doing needle biopsies, ultrasound guided needle biopsies. Those are not accurate at all, and I wouldn't waste my money doing those. So you're either going to do the laparoscopic or the surgical biopsy, or we can do what you and I did, was we decided just to put your dog on a chelating agent called depenicillamine. And my personal opinion is the dosage of depenicillamine in our formularies, our little book we look up the dosages on, is way too high. So what we did with Emlyn was we cut that in half, and we put you on our dog food and cut your depen in half. And then I think we did 45 days or something like that. And then it came down. So we knew that we were on the right thing. So do we absolutely unequivocally know your dog had copper storage disease? Not really, but yeah, I'm 99% sure that what we did saved your dog's life, or what you did saved your dog's life. You allowed us to guide you in doing this. So you made all the right decisions. So you should be proud of yourself. And we hope that becomes sort of the normal with veterinarians. Okay, we've done this, we've done that. Let's try a little depen and monitor it for a month, see what happened. And I think that's a much better way to do it, in my estimation. The problem with doing the biopsy, you can spend $3-4 grand doing the biopsy, and at the end, you get a disease you couldn't treat, so you spend $3 or $4 grand and you still don't have a pet when you get done. But you didn't do the biopsy, and you still have Emlyn, and Emlyn will get something else someday, and I may not be there to help you, but we'll get her as far down the road as we possibly can. And she's going to have diabetic cardiomyopathy, she's going to have hot spots, and she sure as hell isn't going to have copper storage disease. So you should be in good shape from here on in.
Well, like I said, it's the best Christmas present ever. We tested her levels recently, and 2 times they've come back completely normal. We're going to test her ALT levels one more time, and then I think I'm in the clear, because I got 2 down clear. I want 1 more, 3 clear, and I'll be happy.
Well, we should tell everybody that's watching today that we went through the thing where it came down and it went back up again, and you were like, "Whoa, no!" and then it came back down again. So
yeah.
That was.
It's a roller coaster ride.
And it's a roller coaster. That's right, and that's what veterinarians have to do. They have to stand back and watch what's going on, and if it's all in a general manner, if it's going, you know what? At some point in time, Anne-Marie, you got to go ahead and say, you look at your dog and say, "Does your dog look better now than it looked a month ago? Does your dog look better this week than it looked last week? Does it look better will it look better next week than it did this week?" And you always got to watch your patient. I mean, we can follow the numbers, and I know everybody. You all kind of like watching the numbers, and I mean, I'm interested in the numbers. I'm also really interested in how the dog's doing.
I must admit, it was when she went through the rounds of depenicillamine. I literally had friends that know Emlyn very well, neighbors, friends, that said, "Oh my gosh, her energy, her personality, her engagement, acting like a puppy again." Once that copper got out of her system and she was switched over to Voyager Dog Food, so she's on no medication now, but strictly healthy dog food, and she's on Denamarin, which is a liver support supplement, just to keep her liver healthy.
Well, and I feel a little bit bad, because I think sometimes they think this is an infomercial. This is not an infomercial. This is just something you ought to know as a dog. End of story. And if you want to buy our food, that's fine. But in reality, people just need to know where all the landmines are. And I think that's the important part, that they understand that this is going on. Okay.
But Doc, in the sense of just thanking you for the guidance and the help. And if people want to learn more about copper storage disease, if they want to learn more about your dog food, or just in the sense of being empowered on what steps they could, because you guided me through this. I went to my local vet, I went to an internal medicine vet on the coast here in Florida, and I felt as though I was getting the runaround, and I wanted to do the best for my dog. My dog was going on 10. It wasn't a financial situation, but it was a fact of not wanting to her go through surgery if she didn't have to, because everything has complications, right? But I thought, roll the dice. Let's try the depenicillamine. Let's do the healthy dog food, and let's give this some time. And it worked.
Well, if I might say this, I think that one of the reasons this is underdiagnosed is because not everybody's going to be able to spend $3,000 or $4,000 for a biopsy. So it's our impression that only about 1 out of every 20 cases that are existing today are actually being diagnosed as such. So that means if there's 5,000 cases right now, that are being treated that have biopsies, then there's really 100,000 cases. And so, and I don't think I'm, exaggerating on this. We think that, in fact, I think every veterinarian in America is seeing one or two of these cases currently today. And there's 60,000 practicing veterinarians. So you're looking at 100,000 cases. I don't think that's unlikely that's what you have, but hopefully people get to see our video and I get to see our data and our discussion here today, which I think was a healthy discussion. And I'm very happy for you. I'm glad you're going to have a good Christmas with your dog, and I'm very happy for you. So. You did a good job, yes.
Oh, no, I have to thank you, Doc. We did it together, but I have to thank you.
And I want to mention this, that there's other veterinarians working on this very problem right now. Dr. David Tweed at Colorado State, Dr. Sharon Center up at Cornell, Dr. Langlois at Michigan State University, and a lot of people working on this. This isn't just my thing. I'm just making one of the solutions for this.
We hope you enjoyed today's show. If you have any questions, please feel free to contact us at comments@yourlifetv.com. If you'd like more information about copper storage disease or would like to contact Dr. Pete, check out his website at safedogfoods.com. Well, until next time, remember, it's your dog's life. Help them live it well. Right?